Hello, welcome to HLA Live. HLA Live is our regular broadcast on the HLA YouTube channel as well as all the other social media channels. Each week we talk to interesting people from across the HLA community.
Good evening, everyone. I am really excited to be chairing tonight's meeting.
Hi, I'm Rosie Spooner and I'm hosting HLA Live this Wednesday.
And I'm an HLA scholar and I'm also going to be your host this evening.
To share with us their ideas and their innovations and hopefully bring them to a global audience.
Quite quick, we have ideas, let's do this, let's do that. So
many of the topics come from our community, with scholars and faculty expressing an interest in many of the discussions that we're about to have.
Hello everyone and welcome to the HLA Live session on widening participation in the postgraduate realm.
Homelessness and health.
Addiction and the new normal.
HLA programs are built on 6 pillars. The leader is an innovator and entrepreneur. The leader is a communicator. The leader is a manager. The leader as a negotiator. The leader as a follower. And the leader as a philosopher. If you are interested in becoming a HLA scholar, why not get in contact? Many of the episodes in HLA Live will cover one or more of these important pillars. The HLA team consists of Pedra, Eamon, Tim, Riddy, Alistair, Adil and Trisha, and a range of other HLA scholars and faculty.
Hi everyone, so thank you so much for joining us today at this incredibly unique dental panel at our HLA Conference 2020. My name's Asha and I'm a portfolio dentist working within the NHS. I hold clinical, educational and leadership roles within dentistry as I work as an oral maxillofacial surgery dentist, a clinical teacher and a senior leadership fellow. I'm currently an existing Healthcare Leadership Academy scholar and I'm honoured to have the wonderful opportunity in hosting this year's dental panel where I'm joined by some incredible, inspiring dentists and leaders within our profession. We've had the privilege of some of our panel members actually speaking at this year's conference, and I would love to introduce you to our 4 panel members who join me today. So I'll start off by having a short introduction from each of the panel members, and we will start off with Andrew. So welcome, Andrew.
Thank you very much, Asha, and it's been an absolute thrill to be involved with the conference, and thank you to the organising committee for the invitation. So I'm Andrew Dickinson. My background is that I work for Health Education England, where I'm a postgraduate dental dean, covering quite a large area across the Midlands and the east of England. I have a clinical background. For 15 years, I was a consultant in oral and maxillofacial surgery, and so therefore have a career spanning over 30 years in secondary care. At the current time, it's been a real thrill to be working for Health Education England because it's given me the challenge of working from an educational perspective and working with tomorrow's dentists and doctors. So it's a real thrill to be with you today. Thank you.
Thank you, Andrew, and we're really excited to have you. Next, we'll introduce you to Sharon Upal.
Hi, Asha. Thanks for having me. Great to be here, and especially in a panel like this. I feel extremely privileged. So I am a dentist, graduated 5 years ago now, and have worked in a number of roles from secondary care to community and also in primary care. I currently work as a clinical fellow for Health Education England, but in the Northwest, with my main project being the Advancing Dental Care Review, where we're looking at different kind of innovative training models for the dental team going forward. So great to see what we come up with today, definitely. Thank you.
Thank you. We're so excited to have you on a panel as well. And next we've got Flora Smith. Zara, welcome, Flora.
Thank you so much, Asha. It's so lovely to be with the panelists today and to be involved with the conference. So many thanks for inviting me on. Yes, so I too am involved in the future of the workforce because I'm a clinical senior lecturer in interdisciplinarity and innovation at the Faculty of Dentistry, Oral and Craniofacial Sciences at King's College in London. But my background is very much that of a general restorative dentist, spent years at the cutting edge. And it was really late in life that I went back into education, having gone through master's program myself and then becoming more interested in what I felt I could maybe bring to the undergraduate. So I spend most of my time involved now in teaching and research, and I'm known for being perhaps slightly controversial in some ways, and wanting to introduce, and in fact have been introducing, more arts, humanities and social sciences into the dentistry curriculum.
Thank you, Flora, and we're really excited to have you as well on the panel for some interesting discussion. So last but not least, we've got Jason Wong. Welcome, Jason.
Thanks very much, Asha. Good to be with you. My name is Jason Wong. I'm a practicing dentist, general dental practitioner, partner in the 12 surgery practice in Grantham in Lincolnshire. Until recently, I was the Dental Local Professional Network chair for parts of the Midlands, where I supervise some of the leadership fellows in the programme that Andrew runs. And currently I'm serving as the Deputy Chief Dental Officer for England. Part of my portfolio is involved in developing of dental clinical leadership.
Thank you, Jason. And again, we're really privileged to have you with us. And to all of our panelists, thank you for taking time out in your busy schedule. So in terms of the dental profession, we can see from the panelists that we've had that we have with us today is that there's complete diversity within our profession. So during the pandemic, it has become apparent on a global scale the importance of leadership, and this is no different within dentistry. And I would like to introduce the first area of discussion with the panel members of why leadership in dentistry is important, and specifically during this time.
So Asha, I will start and pick up that baton. I mean, leadership is absolutely essential if we are going to actually achieve any forward momentum. And at this particular time during COVID, we've seen a lot of disruption, and therefore we've got to really be thinking about how do we actually start to look at returning into some sort of normality, how we actually are going to use any opportunities that have come out of this. And more essentially, how are we going to prepare looking forward so that if we are caught in similar situations, we're ready for that. And that takes leadership at all levels. And so I'm extremely passionate that leaders aren't born. Leaders have got to learn to lead, and they've got to work with people, and they've got to develop themselves so that they bring a whole range of opportunities to the table. And I think I'm probably a very good example of being an archetypical imposter syndrome, that I'm where I am, which I shouldn't be, because you sort of find yourself in that situation. And I'm really keen that we now embed leadership right from the beginning, and I think it really should be starting from university levels, maybe even before, but because we've seen a lot of resilience coming out from I don't like the word younger generation, but you know, people at the beginning of their careers have been extremely resilient over the last year, and I think that gives us a firm foundation to build on leadership. It shouldn't be something that you do when you hit mid to late career, and so the only thing I would like to say is we're all leaders. We might not want to step up to be a leader at times, but we all have leadership potential, but it needs to start very early on. And anybody who's been told that they shouldn't be leading as somebody early on in their career, then they would really should go and seek out a mentor who's actually going to reverse that decision.
Really interesting points of discussion there, and I think that I would like to sway that towards Sharon, who probably is at the late stages of her early part of the career, maybe if we could call it, and what she thinks about leadership as a younger professional within dentistry.
Thanks, Asha. I'm glad you kept the young in there. Yeah, no, I agree, and I'll go back to the point that Andrew made around imposter syndrome, because I know that's something that myself I've discussed with you, Asha, multiple times actually, in terms of in some of the roles that we've been in, having been a leadership fellow or in the kind of role that I'm in currently. you do kind of find yourself in that way where you think, oh, I'm around a table where I shouldn't be here. Obviously, someone's going to find out, and they're going to realise that I am an imposter. But I think it's that exactly what you go back to, Andrew, in terms of leaders are made, and you step into this position, and you go through this kind of theory of distributed leadership where you are just asked to step up at a time where you need to. And I think that's one thing that COVID showed us, is that no one's going to hold your hand and take you and and baby you along. You've got to step up to the plate. And I think if I think about myself in March, and I think about who I am now as an individual, on reflection, I think my leadership journey has been huge, even in that short amount of time. And the other point that I pick up on in the other role that I work in, which is with Medic Mentor, is embedding leadership for aspiring dentists at that high school level stage. I think that's so important, the point you made about having that at undergraduate level, but like you said, even before that. So that's something we really work to do, actually, is to embed it at that stage so that it just becomes a natural part of who we are, essentially. It doesn't necessarily need to be taught. But yeah, that's me, I think.
Thank you. Does anyone else have anything to add?
Yeah, just following, have been within the clinical humanities, wellbeing and volunteering modules that run throughout the 5 years of the dental curriculum and the 3 years of the hygiene therapy curriculum. I've put development of leadership firmly in all 5 years and 3 years because it's so fundamentally important. And I also think, Andrew and Sharon, that we should be able to kind of join up between the undergraduate and the postgraduate world and make it a sort of a much more continuous process, because I would argue, and I have done, by saying that actually part of the reason why I wanted to bring humanities into the curriculum was to get students to be able to think from different perspectives and to have different knowledge bases. That's been part of it. And my previous research has shown me that when these early undergraduates start to do that, they actually start to be already innovating and thinking in different ways. And I would say that if you develop these attributes, which are in themselves early leadership attributes, if the only person you end up ever leading is yourself and nobody else, then actually there are reciprocal benefits for that. Certainly if it is even for your own well-being. So I think there's an awful lot to be said for having these themes of leadership introduced at a really early stage. I couldn't agree more.
And I really think that that's so true. And I think that in terms of the dental profession, leadership is a word that some people don't maybe fully understand or resonate with because they don't understand the full concept. And I think that, like you said, you don't have to be leading a massive team to be, doing any leadership involvement. You can lead yourself. Jason, do you really feel that the dental profession has challenges with regards to maybe understanding leadership and in the different settings that there are?
Yeah, I think we do. I mean, naturally, within a dental practice setting, you would expect that the dentist within that context to be the leader of that team. But when you go into the wider concept, and going back to what Andrew was saying just now, about as things have happened, the disruption that had happened, I think that certainly the commissioners within the NHS found the clinical leadership quite useful and able to actually affect the outcomes of what they can deliver. And now, as we restore and recover, we probably will need that clinical leadership again to assess what the priorities are in order to continue to redesign services. But I think that the issue is up till now, it's not really within the dental profession being particularly recognised as importance. and certainly from my sort of background in terms of the local dental network, that was one of the issues, that you had many strands of different specialties, and really people, as you redesign services, you know, you need leadership at all tiers, all across the profession.
Yeah, completely. And I think that in relation to that as well, is that dentistry and where it sits within the wider health and social care system, I think through the pandemic that has came out, and we know that the mouth is an important aspect of our body within good oral health. Without it, we can't speak, eat, smile comfortably. And I think that there's a close correlation between dentistry and the health and social care system, which may be slightly disengaged, or more than slightly. And I'd like to kind of pose the question to the channel of the challenges faced with the current situation of where dentistry lies within the wider health and social care system, and how that can be moved forward in terms of integration. I'd love to just pose that to the panel. Anyone would like to pick that up?
I mean, I'll start on that one then. So I think that the dental profession needs to be fully integrated in terms of the wider health and social care agenda, and especially as the NHS gets devolved across regions and then within specific areas. I think that dental profession needs to be part of that. One of the issues that's been lacking as the pandemic has hit was where the profession felt it sat within, be it private dentistry, NHS dentistry, and all the rest of it. And I think that it's quite important that as we progress, that especially when things devolve down to primary care networks, I think that is something that we need leadership from within localities as well as regionally or even nationally.
And do we feel that it's you know, caused by anything specific or certain of the kind of unknown of where dentistry sits?
Shall I just give my thoughts on that, because I know Jason's keen to get back in, but yeah, I mean, picking up on that thought, Asha, I mean, part of the problem when you start to see things going wrong, there's always a root cause analysis to it, and I think from the dentistry point of view, and these are my personal views, I think partly it's about communication or miscommunication about what is happening out there to the whole health and care system, because to a large degree, being a craft specialty, we tend to be a little bit more siloed. I think that there is an element of maybe distrust, you know, not sure who's actually leading on this and who's actually trying to get different teams talking together, and that's all wrapped up, I think, at the end of the day, with a fear of the unknown, or more particularly a fear of change, and I think we're seeing that a lot of people sort of still talking about going back to where we were, and I think going forward we're probably not ever going to go back exactly to where we were. I think there will be change, and I think it is that unknown and the fear of the unknown which might be driving some of it. And it's interesting. So just talking personally, we have been doing a lot of work with GPs and with pharmacists, and we've been trying to embed that across into dentistry as well. And it is still an area which we struggle with, and trying to get three groups talking together with a common voice. And I think that is part of the problem. And so maybe a leadership challenge is how do you get that? How do you get the language the same? So they actually understand what the end result is that people are striving to achieve, and one of the minor successes that's happened recently is we've had a lot of our foundation dentists working with the CCGs and the PCNs delivering flu vaccines. It's not been easy, it's not been smooth sailing, but the feedback from our foundation dentists is that they now realize there's a different world out there. There's people working to a common goal. It's just something that they hadn't actually really appreciated up until now. And the fact that they've done that in their first year of what is likely to be a 45-year career, I think is a minor achievement, and one that we can hand over to them to build on.
I think there's much more that dentists, that those who qualify as dentists can do. They're highly trained individuals, and I would like to see us being able to do more and being, I maybe it's too early to develop this. I think dentistry is at a crossroads in a way in the UK and maybe internationally, but there is, I agree with Andrew, there is a feeling of, there's certainly a feeling of change in the air. And I think that in order to, you know, I think it's been said before that it sort of clinicians need to make sure that they're delivering what society needs at any one time. And I think moving forwards, we need to develop perhaps the oral physician model of care, where eventually, you know, we will be doing more minimally invasive work that suits everybody, more of an emphasis on prevention. If we're going to go down that road, then it's sort of, you know, at an individual level, you're talking about person-centered care, then you're talking about community level, more emphasis on the socio-determinants of health, and then looking at structural competence upstream. But in order to realistically enable practitioners to practice that way, then the whole funding strategy needs to be changed. So I'm just asking for something simple to be done here. It's
But isn't it interesting, Flora? I mean, it's 10 years now since Sir Michael Marmot published his first report. And I know he's brought an addendum out this year. But I mean, at the time, you know, he was trying to rethink healthcare and social medicine. And I think it's the common thing people say is that change is always slow. But, you know, you use that longer term vision to influence your small term or short term changes. And I think that's something which maybe we could capitalize on, that we know things aren't going to happen overnight, but there are certain wins that we could take away from that. And I think one of the things that I've been listening to and learning over the last few months is the whole inequalities element and where dentistry fits with that. And I heard a very powerful talk the other day saying that when we managed to move homeless into sheltered accommodation back in late March, early April, they had multiple other benefits, not just nutritionally, but it was that you were actually able to help with some of their addictions. And then part of the problem is, particularly with drug addicts, when they were coming off their medication, they were starting to feel pain. And the commonest pain that they felt was toothache. And we were not able to pick that up because we were concentrating on lots of other things, and therefore there is now reports starting to emerge that people went back onto their heavy pain-killing medication just because they couldn't get immediate dentistry. And again, maybe we need to rethink how we deliver some of our services to our most vulnerable in society, not just those who actually have a privilege of wealth that they can actually afford to get their care.
So there sometimes is a bit of a time lag between our medical colleagues and us. And I think that social medicine, the idea of social medicine, it has grown. I'd like to follow up with a plea, I think it was from Noel Verniez and his colleagues, for a movement of social dentistry. And I think that you know, we will have to embrace that movement for the future, definitely.
Great.
And do you think that in terms of trying to push this forward and integrate that within the profession itself, that this should really be coming from an undergraduate level, because IPE, interprofessional education, is not something that's very much integrated or predominant within a lot of the undergraduate dental curriculums. And I think, Sharon, you being the most recently graduated within the panel members, what do you feel about the undergraduate dental curriculum and preparing you to work with other professionals within the healthcare system?
No, I have to be careful here. No, I think that we have an issue with interprofessional education, even just between members of the dental team. So let's be honest, our undergraduate curriculums aren't the best at integrating just dentists and hygiene and therapists and dental nurses. So actually trying to work to a wider thought process of trying to work with our medical colleagues and nursing colleagues outside of dentistry, I think is quite hard. I know different universities have made progress differently on that and are getting better, but personally I feel like there should be more integration, because I feel if you don't know, you can't understand. I think it's this issue around I feel a lot as a postgraduate that it's kind of like when you learn to drive, but only learn to drive once you've passed. You can learn all that theory and all that kind of stuff, but unless you go into these kind of roles, the kind of roles that I've had, and I've integrated outside of dentistry and spoken to, CCGs and all that kind of stuff, and some of the fellowship programs that I've been on, that you really start to understand the wider healthcare system. And I don't actually feel at an undergraduate level that we're really prepared for that, whether that's even just on an understanding or on a leadership level. I think there is a lot of work, and I do agree that that probably does need to happen at an undergraduate level. The other thing, I'll just make a point about your previous question in terms of integration dentistry. I think the issue that we had around coronavirus was dentistry really feeling like, I think has been said, where our role is, and not necessarily within dentistry, more of a kind of, a lot of professionals coming out wanting to help, but not necessarily the system understanding how highly skilled of a workforce we are and what we could offer. And I think that's just because they don't necessarily know. They see us with a drill in our hand and we drill and fill, and that's essentially what we do. But I don't think they understand more of that. And I think that's not going to come from their side. I think that needs to come from us. I think we really need to push onto them in terms of, well, yeah, we are really good, and we are an amazing workforce, and we've got loads and loads of transferable skills that can be used in the wider healthcare workforce. And I think that was an issue before, but I think COVID really shone a light on that, and it's something we need to do something about.
And just picking up on that, Sharon, I was very heavily influenced when I started my leadership pathway, and I talk a lot about this guy, a guy called Les McEwen, who talked about synergistic leadership, and it's something I've always tried to do. And it's about how you form a team, and that team works together. And there are three major components he talks about. One is you need your real bold dreamers, people who are visionaries, the blue sky thinkers, and sometimes they're not the easiest people to work with because they jump all over the place. You've got your pragmatic realists, and they're the people who operate, and I think that's probably dentistry. We like to work in that sort of realist arena and just be operational. And then obviously you have your system designers, and they're the real process people who make things happen. And you do need a balance between the three. And I mean, I'd be interested to hear Jason's views, but I do think that sometimes the visionaries are a little bit suppressed, whereas in medicine they are encouraged. And I think everything is brought back to an operational level, SOPs and the like. Because people want hard facts. So I don't know, maybe I'm just being a bit controversial there, Jason.
No, I mean, I think the system probably doesn't allow for that, because I mean, at the top of the structure where NHS England sits and where Department of Health sits and everything else probably does cause that issue. I think you're probably correct there, Andrew, and it's to do with I suppose where dentistry and oral health fits within the priorities of the wider health and social care, and indeed actually where that part of it fits within the priorities of a dental practitioner and their team. And it's actually realizing and establishing where that connection is made. And I don't think we're there yet. I just don't think, it's if you have leadership, talking of leadership and people representing, and one of the things that we're keen to encourage is that the dentist doesn't sit in the room just saying and dentistry.
Yeah.
Exactly. You don't get that with the other thing, and all across the structures of the NHS you get maybe 3 or 4 from the medical teams within that team, and indeed even pharmacists, but usually you only have one. So that's why we need to develop the whole workforce towards that, and probably not just dentists as well, what the wider dental teams.
Totally agree.
And I think perhaps in terms of leadership and models of leadership, there's still been too much of the old kind of transactional leadership in the systems. And if, again, you know, and Andrew was right, it was there, COVID has highlighted it. But I think we should be moving on generally into a more transformational form of leadership and compassionate leadership. So with all of that, which interestingly runs parallel to a transformative learning theory for learners. So it's about empowering individuals and reducing hierarchies. And I'm sure if our friend and colleague Pete Brennan was here, he'd also be bringing the human factors skills and reducing mistakes and errors. So I think there's an awful lot. In many ways, it's a very positive time if we actually take the opportunities and not be afraid of change. Embrace it.
I totally agree, and that comes back to actually, you know, now restoring a sort of sense of community, rather than continuing to be factious with each other and critical of the way that things are done. Maybe we, you know, that speaking openly, and this is why this conference is such a really excellent concept, you know, talk you know, openly, get a sense of community, and actually bringing more people in to the decision making. Because you know, every organization, I'm sure any of us are in, has a hierarchy. Even if you try to flatten it, there is a hierarchical structure, and it does tend to sort of come as part of the territory as you progress through your career, and actually it really probably should be wider at the bottom, so that we get more people able to contribute and their voices being heard.
And I think that there's a lot of dental professionals that are probably watching this with us today and have joined this really interesting panel discussion. But what words of advice could you give to the dental professionals within the UK of moving forward now through this pandemic, of what they can now do to contribute to the profession and help make this change like we've discussed?
I think there are massive, there's so much work to be done. I think sometimes because we tend to put on our loops, I think dentists particularly can be very, very narrow. I mean, we're concentrating on a very small area, but actually now I think it's the time to sort of occasionally take off the loops and look at global oral health. Look at the bigger picture, the bigger context, the mouth within the rest of the body, us within a community of different healthcare practitioners. and so I would say that there's certainly more, I would say, at an early stage to get involved in volunteering within community groups and seeing what is going on a more social level, to be open to different ways of thinking and different perspectives and take those on, because arguably, in fact, when you look globally in terms of the two most common diseases, non-communicable diseases in the world, with everything that we've done as a profession, we haven't actually done that well. So we need to step up to the plate here and analyze, look at what we can do well, and grab the opportunity and move forward. So I would say to people entering into the profession to make the most, and that it's up to us who are educating and leading already within this group to help educate the generations for their practicing futures, not our own, because they're the ones that are going to be the leaders, hopefully, for the next 40-50 years moving forwards.
From an educational point of view, which is my background, I'm telling everybody that this is an ideal opportunity for co-production, as Flora's talking about, and I think we probably are going into a new era where people are actually going to be a lot more honest and actually say those at the top don't have all the answers. We have the opportunities to influence and to connect with people, but we don't actually have the answers. And there's nothing wrong with that sometimes, not to have an answer to a complex problem. But actually, it therefore needs everybody to step up and contribute. And as we've seen with disruption of training throughout the pandemic, which we are trying very hard to re-establish at this point, say to people, it's not just about fulfilling a curriculum requirement, and so that applies to under and postgraduate. The curriculum is just a map of what would be the minimum really of what a good practitioner needs to achieve. But then there's all the other wraparound stuff, and I would echo Flora's sentiment. I think people should get reconnected with their communities. They should be looking at potential for voluntary work, or more importantly, actually working across the different parts of the system, and that can be done at very sort of low levels. But it comes at a price. It comes at having to sort of step up, decide to go and do something, probably using your own time, and I know that's at a premium these days as well. But actually throwing yourself into a community and not being afraid to look different.
And I think on that note, just sort of my message would be get involved. I think it's getting involved and being part of the conversations that are ongoing and being part of the solution. I think quite often, the idea of working in silo seems comfortable, but actually it's being involved and the responsibility not looking towards certain individuals to lead, actually the responsibility of being right across the piece on everyone.
I think I agree definitely with that point that Jason just made. I think with us all four of us here being dentistry qualified, I'd just throw it out more to the kind of the wider dental team and the importance that is going to have going forward. I think we automatically in dentistry look at the dentist being the leader, and I don't think that necessarily flies anymore, or isn't necessarily the best thing. It's just the right person for the right job, and I think it goes towards patient care as well. So, we need to work in a system that's a lot more efficient than the way that we run NHS dentistry at the minute, where we don't necessarily use each member of the dental team for their right skills. We talk about the right skills for the right time, all that kind of stuff. And we don't use our hygienists and therapists and dental nurses and the great team that we've got around us to the most that we possibly could. And I think once we get that kind of seamlessly across within our own kind of microcosms in the dental team, then I think once that's sorted, then we start kind of bouncing out and trying to integrate properly within the kind of wider healthcare system. But I think that's the issue to start with. We need to kind of fix that. And there are some really good examples of, practitioners and practices that work that way, but it's just not the norm, unfortunately.
So maybe what you're saying, Sharon, is we need to be asking at this point, what does the future workforce look like? What are pathways through that career? But that we shouldn't be looking back all the time at where we came from, but actually look at the real achievable opportunities going forward.
Oh, definitely. I personally think that COVID has actually been a really exciting opportunity for dentistry, because it has showed us that there are different ways we can work, and I think we should really just jump on it and try and do all these different things and really try and make our place in the wider kind of system. But I don't think that's going to be easy, and I think a lot of people want to go back to the way we've always worked, unfortunately.
I think because of the relational nature of care, I think there's the other very important aspect is that when we look at the mental health of those that are in practice, look at the large numbers. I mean, I know that this is across the board, but particularly in dentistry, when you look at sort of dentistry as a group in itself, I mean, it's one of the most highly stressed professions. So I think not only at the undergraduate end of things do we need to do more to prepare students to enter that workforce, but actually there is something fundamentally wrong with the system itself when so many people who work within it in practice are suffering so much. So I think that as we change the model, I think that needs to be a priority, because we know that the mental health of those delivering the care impacts on the quality of patient care.
Thank you so much for all the words of wisdom there, and I think that will benefit a lot of people. And I think one thing that the Healthcare Leadership Academy really reinforces is that if you don't turn up, you can't lead. So just like following what Jason said, you know, if you're not going to get involved, then how can we make the change? And I think that's a really important point. And with our 4 panelists turning up today and spending their time to have this discussion, it just shows that, you know, there's people within our profession that want to make the change. And I think that I may speak on behalf of us all to invite, you know, the dental profession to help make that change going forward. And really thank you so much, Andrew, Flora, Sharon and Jason, for spending your time today. And I'm sure that this discussion has really generated a lot of light bulb moments in some people's heads. So hopefully going forward, we can make a change together as a profession. So thank you very much for joining me.
Thank you. Thank you, Asha.
Thank you.
Thank you to everyone that made tonight's episode possible. Whenever our scholars are thinking about complex problems facing our health systems, we encourage them to think about how they make significant change in the world of healthcare. We are incredibly lucky to have some incredible scholars in the HLA. They use the HLA as a platform to take their ideas and bring them to fruition. If you are interested in the work of the HLA, why not join us at one of our future HLA events? Why not join one of our programs? Why not even become a HLA scholar? Thank you for joining us. My name is Johan Marlewander, the Director of the HLA, and it's a good night from all of us.